Good afternoon, Les. How are you?
Good afternoon, Madam Mayor. Thank you very well. Thank you very much indeed. And thank you for squeezing me in to your busy schedule.
Oh, no. I think I'm a woman more squoze than squeezing, if I can say that, because I know you must be unbelievably busy at the moment. Just in case people don't know, we're talking to you now because of your role at the Citizens Advice Bureau.
Indeed,
so let us know, how is it with you at the moment?
So it's been a tough 6 months. I don't need to tell anybody that, do I? It's been a very difficult time for all of us in the country and even internationally. We had to shut our services, some of our services very, very quickly because of the nature of the way that, the emergency situation hit us. So, a lot of the work that we do is about face-to-face. It is about being in Keynsham and Midsummer Norton and, of course, in Bath. It is about going out, in some cases, to people's houses and supporting them. And unfortunately, with the nature of the pandemic, all of that had to stop very, very quickly. I mean, literally in days. Wow. So we moved, we retreated back into our sort of back office situations in the early stages in Midsummer Norton and in Bath. We tried our best as we could at that point to support. But obviously with the increasing restrictions, we had to shut those offices in line with most other people towards the end of March. So from then we moved everything remotely, but our team did an amazing job.
I was going to say that's so difficult to, because I imagine you're in the eye of the perfect storm. The need for your services was going up just at the time when you had to sort of retrain everyone to provide those services in a completely different way.
Yes, indeed. And that was the biggest challenge. So not only the tech challenges and moving everybody to remote working, from their kitchens, from their desks, from those fortunate enough to have an office, but also, it was the nature of the challenge was increasing. And of course, lots and lots of stuff that was happening was all new to us, furlough, the self-employed scheme, and the various things that were happening in terms of the government reacting very, very quickly, sometimes in hours. Was a real challenge for us because, of course, we update a lot of our information on our websites, both nationally and locally, so people have got sort of one credible source of the truth when they're looking for sort of legal advice, benefits advice, and housing advice, and also debt advice. So that was incredibly difficult to update all that.
What did you find? Did you find that the questions you were being asked and the people who were approaching you were different from your normal clients, or did you find that, in fact, what you said, that you're almost a one-stop shop for people to get directed to everything other than, I guess, the pure health advice, to which, they'd be going to NHS 111 or someone different? What were you being asked during this period?
So the biggest change really came for us, came around, obviously, the changes in sort of income and benefits. In the end, there were 4.5 million extra people that went into the benefit system, predominantly on universal credit, which obviously is a bit of is a very difficult sort of benefit to sort of understand and work your way through if you're first claiming it. And then, as we know, there have been some hiccups in the implementation of universal credit. They've been widely trailed in the media before we had COVID. So, quite simply, when you've got that many millions more people, you do have to pay respect to the DWP that they did cope, quite well with that huge increase on their services. And also, of course, in terms of other benefits such as PIP, personal independence payments, disability payments, DLA and so forth, all of that went up. So we were dealing with a lot of that. We were dealing with a lot of inquiries around the initial stages of furlough and people not understanding furlough and how that was going to work. Obviously, in the earlier stages when the self-employment scheme, income support scheme came out, dealing with lots of that as well. What has been kind of on hold but has come now to fruition is lots of debt stuff. So, of course, we were all quite fortunate that there was a stay on, for example, evictions and property actions where people could be unfortunately evicted. That all stopped and was delayed until the end of August, and indeed has now been extended again until the end of September. But that has come into play more in the later months as well.
Right. And now, what situation are you in now? Are you opening the offices at all? How's it working for you as lockdown has sort of eased a bit?
Well, the biggest thing that obviously, perhaps the stage just before that was, of course, the biggest thing that we got involved with was, of course, the Compassionate Community Hub. So we were one of the founding charities, one of the founding organisations involved with that, along with BANES, of course, BANES Council and various council departments, neighbourhood support and community engagement and welfare. And also, of course, Virgin Care's heroic support of that, and BANES 3SG as well, where, as you know, I'm a trustee of BANES 3SG as well. So the response for those organisations, and then other charities that came and supported like us, Bath Mind, Reach, DHI, we all rallied round. And that was in direct response to the different nature of those challenges that we just talked about. The fact that they were so vast, so quick to hit us, and were constantly changing in nature, that we needed that partnership to work together. And as obviously COVID, developed through April and into May and June, so we strengthened the hub partnership and grew the hub partnership, working uniquely really with BANES Council, with Virgin Care and with the third sector, and making those things work together. So that's really how we adapted to respond to that challenge. And that work now still continues, fortunately, it still carries on.
I mean, one of the questions I was going to say, what are the things that, I mean, no one is saying the pandemic's been a good thing, because of course it's, there's some people who've had unimaginable horrors and it's been terrible. But we maybe have learned some things that we've done differently that we may want to carry on into how we carry on operating in the future. Is that the same for your organisation, would you say? Are the things that, and it sounds to me like you've built partnerships now that will last forever?
Yeah, absolutely. Taking from great adversity some positives from great adversity. We have been able to build a very strong, actually long hoped for partnership between the local authority and Virgin Care, and also the third sector and the voluntary sector. So actually the hub didn't really happen by accident. No. It happened because those conversations were actually going on with various champions in the council, in Virgin Care, and in the various charities and 3SG that were involved. And we were actually all, certainly, the concept of this really started about 3 or 4 years ago. But actually in the last year, it had actually gained quite a lot of momentum to actually work towards a hub concept. So the dreadful opportunity of COVID actually precipitated and was a catalyst for those partnerships to pull together. Quite simply, I got a phone call from Virgin Care, James Carlin at 3SG, and also from some of the BANES team, the welfare team, and also the Dave Dixon and Sarah Dixon in the neighbourhood engagement team, and we were saying, look, what we've been talking about for years would be absolutely perfect if we could do it now, wouldn't it? And a building became available at Peasdown St John, and literally we all turned up there sort of the next day and started to make things happen. Then we were able to plug in, of course, the amazing resource that James Carlin was able to bring in through 3SG, which was these 2,000 community connectors. And then we had a frontline service, of course, which, thank you so much for your support. And, food delivery, medicines delivery, leaflet packing and distribution. Thank you very much, Madam Mayor. You've been at the heart of all of that, and you know how important that service has been. But for the hub concept, all of a sudden we had a frontline customer service delivery point in those volunteers, which was actually quite unique across the country. So that's how we adapted the model. Now, in terms of Citizens Advice, so we then, when we couldn't offer the face-to-face, we compensated by putting more people on the phones. We also added in a web form on our own Citizens Advice BANES website. But of course, we also had the hub team that were supporting us, and we were getting specific inquiries then around work and money. And that is how we were supporting people mostly in the early stages. So the calls we were getting, the 90% of calls that we were getting in the early stages were unfortunately people phoning out and saying, I've got no food and no money, please help me. And that's what we were dealing with to start with.
Yeah. And I mean, you must have felt it because you were far closer to the cutting edge than I was, but I was genuinely humbled by how people absolutely pulled together. That, we saw very, very little of the worst of people, but we absolutely saw the best of people. Even in sort of small micro communities, there were WhatsApp groups set up. There was a whole heap of, I've managed to get some milk. I know that you haven't got any. Would you like it? It was at that level as well as at the bigger level. And I think that is something that we throughout the city of Bath should feel proud of. I'm sure there are other places in the country that have done it as well. But I think we really did build some communities that will stand the test of time.
Absolutely, Madam Mayor. Yeah, and without a doubt, that's the thing I think that will continue. You know, it's that sense of community. A lot more people know their neighbours now, you know, and that can't be a bad thing, can't it? Can it?
I mean, in my local area, I don't know how you felt. I'm the same. I mean, I always knew them, and we always just nodded and said hello. Yeah. Actually, what spurred it to a certain extent was the Thursday night going out to clap for the NHS. Yeah. You were sort of sharing an emotional moment where you were sending out your most positive vibes to people. You couldn't then not say, how are you? Yes. And it built up from there. So yeah, and Bath, although it's a small city in some ways, it's also a lot of small villages in effect. Yeah. And I think they've got a much closer relationship. What are your plans going forward, Les? What yes. If imagine I'm your fairy godmother, right, and I've got a little magic wand, and I know, think of the tutu, and I could give you 3 wishes. Yes. What would they be? Because I admire Citizens Advice so much. Thank you. I mean, if I can say from the heart, I used to be, as you may know, I used to be a Samaritan, and the only people we could ever refer people to were the Citizens Advice Bureau because of
Thank you very much.
The work you do and the fact that you are such a trusted name. You know, on behalf of the City of Bath, we are so grateful for what you do. What is it that you want to do next? What are your 3 wishes?
Well, so I would say, firstly, obviously has to be the hub. I think, and this great work is continuing, and we've got some very senior champions, you know, some of the divisional directors, Will Godfrey, for example, and also Dina and Richard Samuel, and a lot of the senior councillors as well are very supportive of the hub. Rob Appleyard's visited on a number of times now. We've had the MPs visit as well. So we've definitely got that support. But I
don't think I've had an invite, I'm just saying.
Right, okay, well, we should put that right immediately, Madam Mayor. We should do that in a very socially distant, safe type way. Of course, you're more than welcome to come along. Thank you.
Didn't mean to interrupt you, but yes.
Yes, so we've had lots of shows, obviously declarations of support and all of that excellent stuff. And we've had physical, obviously, partnership delivery, service delivery on the ground. So my first ask would be, firstly, of course, let's carry that on. Let's make sure that the hub continues. Let's get down to a bit of brass tacks. Let's work out how that can be supported and sustained and funded between the 3 key partners that are there, which are BANES, Virgin Care, and also the third sector. Everybody's got their part to play in that. And it shouldn't only just be about the money, but actually the value add, if we realise the value add of having those organisations all working so closely together, the efficiency and effectiveness and the better service for residents is unquestionable. It's a far better service, and I know that great work is going on to carry it on. So number 1 is I hope for success in that work, and we can talk about the hub continuing for years rather than sort of months. So that would be number 1. Number 2 would really be for us to be able to continue to grow and develop our services. We've gone through a very tough time. All of the country has over the last 10 years in terms of, after 2008, there were some really big economic challenges. Unfortunately, the axe fell on a lot of local authorities, and cuts have had to be made. And I completely understand that. And we see that all around us. But something that COVID has demonstrated is that if you keep cutting, when you do have an emergency, all those things that you used to rely on are no longer there because they've been removed. And so I would hope that we now start looking at what we can kind of build back in. So my second wish would be, let's build back in, let's consolidate what we know has worked. So the support network we give at Citizens Advice, as you say, one of our Achilles heels is that we are the generalist service. So we offer advice. We love all, serve all. We have the front door open in normal times, and we answer any question that comes in. Now, we don't profess to deal with all those questions, but we certainly signpost and refer and make sure that citizens have the best service they can. But that needs to be funded and supported as a charity. And we're not a statutory government body, as you know. We're not a BANES. We're not a department of BANES. We rely on donations and support. So it's for that continuing would be my second wish, and then thirdly, it would be about increasing the partnership working, and our value add back to the community, and really being able to to get our message of support out to as many members of our community across B&NES as we possibly can, because it's not just all about Bath, as you know, Madam Mayor. You know, you support the whole of B&NES, Bath, and we are truly Bath and North East Somerset.
I actually, just to interrupt slightly, when I'm wearing this, I'm the Mayor of Bath, so yeah. I only think about Bath, but you're right, the larger authority is you know, and the work you do has to have an outreach into areas other than the ones that we cover. Yes. Yeah,
indeed. But of course we are champions. You know, none of this unitary authority survives, you know, without all of us being in it together. And, you know, of course, Bath is predominantly often the economic engine, but actually we need to bring everybody along in that journey, as you know. So my third wish being obviously Citizens Advice B&NES, we would look to obviously, you know, ensure that our influence and our support is spread across the unitary authority, but also into sections and age groups, and perhaps sometimes socio-economic groups, and perhaps also from an equality and diversity point of view, you know, to groups that sometimes don't know about us or don't know the support that is there for them. And my third wish is that we can reach those people and help them as well, because sometimes we're challenged on that, and, you know, we have to be honest about that.
I mean, I think the last time I saw you physically was when you were launching at Twerton Park.
Yes.
Yeah. So that talks to what you're saying about finding a way of getting to people who might not, well, frankly, they may not even have the bus fare to come into town at the time when you were opening the offices, and you were there to give advice where people were going to be anyway, rather than expecting them to come to you. So I think that is a really powerful thing to end on, if you don't mind me saying.
Yes, excellent. Thank you.
Can I thank you so much for your time? It's been amazing. And can I reiterate, on behalf of the City of Bath, so value what you and your organisation do. Thank you.
Yes, thank you very much. And just sort of in response to that, Madam Mayor, can I also say, you know, for my support for the Mayor's office, because as you know, I've worn a number of hats in the city over the last decade or so, setting the Business Improvement District up, working for Visit Bath, and also working regionally. And the Mayor's office and the Mayor's support has always been absolutely vital and fundamental to all of those organisations I've worked for that have been so important to the city. And it's really important that the hundreds of years of history that the Mayor's office represents, and the tradition and the neighbourhood and the community support that the Mayor's office supports and delivers, it must continue, because it's a vital part of our offer in our city. So thank you for all you do, and let's hope this continues for many, many more hundreds of years.
Thank you very much.
Thank you.